back in Torrevieja and we're on the Costa Blanca. We've got some latest news for you, especially if you smoke, because it's not looking good. Also, not just that, there's a big major shake-up on the health system as well. So yeah, make sure you watch it to the end, because you're going to shock what's going on now in Spain. It's just new regulations all the time. Spain says there's going to be major overhaul of the health service, and also they're going to ban vapes, and also a lot of other things going on as well. Just that, they're talking about banning smoking in cars as well. The next few weeks they're going to be discussing all this. Spain's Ministry of Health, and there's going to be big changes and a big overhaul and everything that's happening, all to do with the health. So making rules and registry things for people that are going to be doing these recreation things. So they're talking about rules as well to do with abortion and pregnancies. So yeah, let's crack on with all these new rules and regulations coming in. And all this has been going on for years. And yes, so we're going to talk about the pregnancy malarkey and the rules they've been talking about that in the hospitals. Saying a lot of objectives to pregnancies and terminations, aiming at preventing the entire hospital units from declaring themselves objecting against and refusing to perform abortions in Spain. So yeah, they're trying to basically wrap it up in one. People that are going in hospitals want an abortion and trying to get the rules sorted out about it, and so they don't refuse to do anything. So yeah, Health Minister of course doing all this is Monica Garcia. So she wants the registry sorted out and the rules and everything. So where before you had this loophole, basically the women were denied access to abortion. So yeah, she's sorting all that out. And the reason why she's doing all these new rules is because 81% of people were having all the abortions done in private hospitals and clinics. She's doing this registry office thing where you make sure that the women do have access on the public health, and it's all carried out without having to go private, because last year, like I say, 81% were all getting it done privately. It's the abortion registry. Now we've got the vaping registry they're trying to sort out about this vaping malarkey. I want to ban all this disposable vapes where you buy them and once you're finished with them you can't refill them up, of course, because they're disposable. So they want to outlaw all them to start with. So they want to take all the pretty colours off and all the flavouring off these vapes as well, just like the old cigarettes, to stop people starting up the habit. Only that, they're talking about banning smoking as well in cars travelling with children, which probably is not a bad idea at all. And the government's also announced another thing as well. They're talking about announcing all these new plans of regulating, and the government's also talking about other things as well. It's announcing the plans to regulate the cannabis, the use of cannabis just for medical purposes. So they're drafting up these regulations, and all going to be expected to be published very soon. Even though she's drawn all these plans up, just like before, she's also tried to get this banning in cars, and also people smoking when they're pregnant. She's been trying to get this through the old bill here, but she's not done it before, but she's really confident it's all going to get pushed through this time. So yeah, all these new regulations. But yeah, when they're talking about the cannabis, they said they're not going to be letting people obviously smoke it. It's only strictly for medical reasons. Government also said they're going to have in the hospitals a place for the glasses, where people are going to have their eyes tested, and especially for children, have a kind of a budget for them, and contact lenses and all things like that. So yeah, big shake up in the health system. This vaping is the first step from trying to ban it all together. There is rumours going that in 2026 it's going to be completely gone. So the first bit they're trying to do for 2025 is obviously trying to control it a little bit, get all the advertising, nicotine, flavours and all that off it, stop encouraging children from smoking. But yeah, lots of reforms, and I don't know how they're going to monitor people smoking in a car with children. But let's see how this one goes. Let us know what you think about these new reforms in the health system.